You're listening to an interview taken from the Tonic Talk Show and Podcast, heard exclusively on Zoomer Radio. To download or listen to the original episode or other episodes of The Tonic, please visit thetonic.ca.
Andrea Donsky is a registered holistic nutritionist with 20 years experience in natural health and wellness. She's the co-founder and editor-in-chief of naturallysavvy.com and a regular contributor to Tonic Magazine. Welcome back to the show, my friend. How are you?
Oh, I'm good. Thanks for having me again, Jamie. I love talking to you.
Yeah, it's always nice to chat. And, we're chatting about a topic. It's interesting. You're here. We're talking about what is predominantly, if not completely, a men's health issue, and that is prostate health. So why are you here today? Explain it. Explain yourself, madam.
Okay, I'm doing it. All right, so it's a great question. And the thing is this, I'll be married 21 years next month, and I have a son.
Yep.
So it's important for me to understand potential issues that can affect the prostate gland, right? So I look at it as something similar to snoring.
Yeah.
It's funny. I recently told my husband that he snores.
Yeah.
And that he should get it checked out. And his response was, I don't hear myself snoring. I don't snore. I don't know what you're talking about. Now, funny response on his part, but not so funny. Because as his wife and a mother, because I mentioned I have a son, I do feel it's my responsibility to make him aware of it and help in any way I can.
Yeah, I mean, when I carried the extra weight, I was snoring all the time. And there are certain health risks that if you're not aware of it, it's important as a partner to see it, right? Like you can... Yeah. That being said, I tell Naomi that she snores sometimes when she doesn't, just to keep her honest, so...
I'm sure she loves that.
Yeah. No, it is important. Obviously, everybody loves their partner, or hopefully they love their partners, and you want to see them healthy because it's, we're all under more stress, and it's important, as a team, right? You're healthier as a team if both members are healthy, so it's a good thing, right?
And the thing is too is that there's so much research out now. Like, I mean, obviously, we're talking about prostate gland, but you're mentioning snoring. There's so much research now on snoring that it's important that you get things checked out, and just don't let it be. Right. Go to the doctor, speak to your doctor, healthcare provider to find out what the underlying issue is.
Right. And this is timely, too, because it's Movember. So men's health issues are obviously prominent. But for those who don't understand the issue, let's talk about the prostate gland and what may happen. So let's start at the bare bones.
Sure. So the prostate is a gland that's the size of a walnut, right? So it surrounds the urethra, and it's essential for male reproduction. That's kind of how you could think about it. So as men age, an enzyme called 5-alpha reductase is produced in the body, and it affects the size of the prostate because it converts to testosterone, which then converts to dihydrotestosterone, or DHT. Now, a mouthful, even hard for me to say.
Yep.
But basically, DHT speeds up cell growth within the prostate gland, causing it to get bigger. And very high levels of DHT can lead to benign prostate hyperplasia, also known as BPH, which is a non-cancerous abnormal cell growth of the prostate gland.
I just want to pause there. So when we're talking about prostate health, we aren't like there's cancer and then there's BPH, and they are two different things. And
two different things, but have similar symptoms.
Correct.
Which we're going to talk about, yeah.
Yeah, okay. So BPH, anything else we need to know?
Okay, so, it's actually a very common thing. So, if you're listening right now and you're like, well, I don't think it can affect me, it's actually very common. According to the Canadian Urological Association, more than half of men in their 60s and up to 90% of men in their 70s and 80s experience symptoms associated with BPH. So it's, like I said, it's a very common thing. And it represents more than 3.7 million Canadian men. And experts believe, listen to this is so interesting, that genetics, lifestyle, diet, and inflammation all play a role. So the good news is changing your lifestyle, improving your diet, like eating whole, unprocessed foods, staying away from sugar, limiting red meat and dairy, managing blood sugar levels, very, very important about the blood sugar. Losing weight and exercising all play a role in helping to control it.
Let's talk about BPH and how it manifests. So if you have BPH, like what are you experiencing?
So as the prostate gland grows, like we talked about a little bit earlier, it applies pressure on the urethra and the bladder.
Which is right
next. Common symptoms.
Yeah, they're right next door. So as it gets bigger, there's less room, and it sort of restricts the flow, as it were.
Exactly. So what happens with that is that it can lead to common symptoms like having trouble going to the bathroom or peeing, a weak stream, having a sudden urge to pee, stopping and starting while urinating, and frequent urination, meaning you're going a lot and it's even waking you up during the night.
And that's the big one, right? As you get older, men find themselves waking up more and more in the middle of the night to go to the bathroom with less satisfactory response.
Well, that's it. And I think the key, what you want to pay close attention to is that if you notice that it's disruptive, in your day. So as a woman listening, or for your men who are listening, like when it becomes something that's disruptive for you, for example, you can't sit through a movie, or you can't sit through Sunday's football game, or you don't want to go for a walk or do other activities because you're concerned that you'll have to go to the bathroom, that's when it becomes something like, hey, wait, I need to go see my doctor and find out what's going on, right? So even for women who are listening right now, if your husband or partner or son or somebody that, in your life does not, or male friend they're not talking to you about it, pay attention to it and ask questions, because they may not go seek, their doctor's advice. They might not go for a checkup, but it's something that you could recommend to them, especially if they're exhibiting a lot of the symptoms or all the symptoms we talked about.
Okay, so basically you might have BPH if you have those symptoms. So let's just quickly go over them one more time.
Absolutely. Okay, so having trouble going to the bathroom?
Yep.
Or urinating, so a weak stream, having a sudden urge to pee, so you really have to go and it has to be like right the second, stopping and starting while you're urinating, and frequent urination, meaning you're going to the bathroom a lot and it's waking you up throughout the night.
Okay, so this is indicia that you might have it, and then the protocol would be to go to your doctor and get a diagnosis. That's crucial, right?
Absolutely. Now, the thing to note is that it actually has very similar signs. So BPH has very similar signs to prostate cancer, right? So other than painful urination and blood in the urine. So these are the things. And, Jamie, I'm a true believer that if there's something that's not feeling right to you, you know your body best. And if something is off, go seek professional help. Go to the doctor, go to your healthcare provider, find out what's going on. Don't just let it continue on and just be like, it'll go away on its own. You definitely want to make sure that you get a proper diagnosis.
And, I guess that's kind of the theme of the show today, right? Because a lot of men, and I happen to be in this camp, we don't necessarily respond to what our body is telling us, right? Like it kind of takes our partners to say, hey, you have that back pain, or, you haven't really taken care of those muscle cramps or whatever it might be, because as men, sometimes we just don't want to, or, we're nervous about the thought of, a diagnosis, so we don't act on it.
And I love that you're mentioning that, because I think, yes, men tend to not seek help or medical help as much as women would. But I think the key is that men take responsibility for their health. We all need to take responsibility for our health, right?
100%.
So, I mentioned Rich, or my husband, earlier on in the interview, and he, with the snoring, and I kind of made a joke, but actually Rich is pretty good. Like if he feels that something's going on, he'll go to the doctor. He may not even mention to me that he's going to the doctor, but he'll make a doctor's appointment and go. So I really want that to be an inspiration for your listeners, because I think it's an important thing for everyone, including men, to take responsibility for their health. Yeah, no,
I don't mean to be reinforcing gender stereotypes, right? Like, we're all, at the end of the day, it's not what the wife does, not what the husband does, or the female partner or the male partner or whatever. Like at the end of the day, it's you. And as you said, you know your body best. So if these things are happening, you got to take care of it. That being said,
we're the captain of our own ship.
Exactly. That being said, if you're the first mate and you see your captain isn't responding, maybe you could help them along. So let's move forward a bit. So let's say, for argument's sake, your doctor confirms that you do have BPH. What's next?
Okay, so there are prescription drugs that he can take, or you can take. There's also surgery for extreme cases. However, most of the time it's more of a watch and wait approach, meaning getting yearly checkups with your doctor and making lifestyle changes similar to what we talked about a little bit earlier. Now, there are also natural supplements or nutraceuticals that you can take during that phase of that watch and wait phase, and it'll help to reduce the swelling. So, for example, there are 35 plus human trials on saw palmetto for helping urinary tract symptoms. But the key is you want to make sure that you're taking it in high concentrations, meaning 95% fatty acid content.
Mm-hmm. And are there other sort of natural ingredients or supplements that have proven to work?
Yeah, like there's something called plant sterols that can help reduce inflammation. There's rye flower pollen. That's another ingredient to look for. It's been well researched for reducing urinary frequency. And of course, the stars, the vitamins and minerals like selenium, zinc, vitamin D3, and B6. These are all important ingredients that you can get, whether you're taking it as a supplement or even in your diet.
Okay. So like you mentioned lifestyle choices earlier in our interview. Let's be clear, like the lifestyle choices will help with your general health. And, if your general health is better, that will help with issues such as prostate health. But exercising more doesn't mean you're going to reverse BPH, right? Like that's not what we're saying, right? Like exercise and a good diet helps, but supplementation and medication and treatment is probably going to be necessary, correct?
Well, exactly. So there's nothing guaranteed of anything, right? So there's so many things that come into play. So genetics, like we talked about, lifestyle, diet, inflammation, like things that are going on in your body.
Right.
So like anything, it can all help. It doesn't hurt, right? So if you have an issue and you know that, let's say a food is causing it, and you eliminate that food from your diet because that's now going to help reduce the inflammation in your body, all of that is very helpful. So there's never a guarantee, but what we do know is changing your diet up, eliminating the offending foods, eliminating the foods that are creating the inflammation in the first place, all of that, exercising more to get your body into good shape, all of that plays a role to help control it. Can it cure anything? Of course not. We would never say something like that.
Okay, so let's talk about these supplements. So, if listeners are curious about the supplements, what sort of comfort can we give them that these are tried and true? Like, have people investigated, and are there studies regarding these products?
Oh my God, absolutely. Human studies, in fact.
Okay.
Yeah, which are the best.
So what else would you recommend in the circumstances, like based on your experience and what you've learned in looking at this?
If you want to eat properly, and specifically for the prostate gland, so we talked about, the vitamins and minerals like selenium, zinc, D3, B6. So I would say go for foods that have them in it. So for example, Brazil nuts, they contain selenium. Have a couple of Brazil nuts every single day. Pumpkin seeds, it's hello, we're in and around Halloween, so we're fall, so there are pumpkins are abundant. Pumpkin seeds, sunflower seeds for zinc. Bananas, oats, you want lean chicken, all of that is great for your B6, and fish and eggs for your D3. And you can also take supplemental D3 if you wanted to as well. And then you can also, again, Jamie, like we talked about, from the supplement standpoint, you can look for a supplement. So if you're like, I'm going to eat all my food, but I really want something that's easy to take everything in like one shot, which I understand because convenience is very important. So there are supplements out there that come in the right dosage, and that's the important part. So like I mentioned about the saw palmetto, you want to make sure that you get the dosage that's appropriate, right? So that's the 95% fatty acid content, and the concentrations play a huge role in actually helping with BPH and controlling it, right? So you can also look for a supplement that has all the nutrients that he needs in it, which is more convenient. And in many cases, it works well for us because also it has the right dosage. And that's important, like I mentioned with saw palmetto. So New Roots Herbal, they have a product called Prostate Perform that you can find at any health food store. Now, obviously, I haven't tried it myself, but the company shared some data with me showing how men see results in as little as 7 to 10 days, which is pretty cool.
Yeah, and that's really the key with BPH, right? Once you start looking into the treatment and dealing with it head on, you should see results very quickly.
And like you said, Jamie, earlier, and I think the key is taking control of your health. If you see something that's going on and you're like, hey, it wasn't like this, even a month ago or a couple of weeks ago, go see your doctor, go see a healthcare professional, find out what's going on, and then implement lifestyle changes, diet changes, nutraceuticals. All these things can help you and hopefully help to improve your symptoms of BPH.
Yeah, and I would say this: if you are a spouse, partner, girlfriend, whatever, and somebody that you care about, you think maybe they're suffering from this issue. If I were that person, how would I respond to my partner sort of coaxing me? I might be grumpy at first, like, just leave me alone. It's fine. I'll deal with it. Mm-hmm. But I think if you might even want to direct them to a website, you might want to direct them to this talk show or the podcast for this and have them listen for themselves. Because, I think once your partner hears how that this is actually a problem that is easily treatable, I think they'll be much more amenable to actually seeking that treatment and following through with it. And at the end of the day, that's really what you're looking for, right? We're all looking for everybody to be healthier and better. Yeah,
100%. And you know what I do? I send texts to my kids. I send texts to my husband. I'm like, here's some research. Here, check out this article.
Yeah, exactly.
So it's arming them with the education, right? So that way we're not telling them what to do as opposed to sharing information, which is pretty much what you just said, which is why I love what you said.
Fantastic. Well, thank you so much for coming on the show today.
Thanks, Jamie. Thanks for having me.